I'm David Carbone. I'm a thoracic medical oncologist and leader of the Thoracic Oncology Center at The Ohio State University in Columbus, Ohio. And I've been asked to talk about biomarkers and precision medicine and lung cancer, and those two things go hand in hand. And if we haven't learned anything in lung cancer in the last decades, we've learned that every tumor in every patient is different, and that a one-size-fits-all approach is not the optimal way to treat lung cancers. And today, virtually every aspect of lung cancer care is determined by effective use of biomarker testing. Initially, that testing was impactful, most impactful in metastatic disease, but now more and more we are evolving our treatment strategies for earlier stage disease in a biomarker-dependent way. And so it's really incumbent on anyone who treats lung cancer to really put a priority on the assessment of relevant biomarkers before making any therapy decisions. Current testing rates are not 100%, and various studies show different rates, but overall, it's about 70 or 80% of patients get some kind of biomarker testing, which is insufficient by itself. But the fact is that the latest data I've seen is less than half of patients actually have their therapy wait for initiation of therapy for the results of the biomarker testing to come back. So we're often in a situation where a patient has started on an empirically chosen therapy, and then a biomarker result comes back, and we suddenly have to change that approach. And that's not an ideal situation for sure. And sometimes the biomarker testing is not acted on, even if it is sent, the appropriate action is not done. So there's a lot of room for improvement in the implementation of biomarkers in practice today. I think lung cancer is the poster child for molecularly informed therapies. And there are subsets of lung cancer where they may be small, 3 to 5% or a few percent, but the therapy is completely different if with knowledge of the biomarker than it would be if the biomarker were absent. So it's incumbent upon practitioners to do a thorough biomarker analysis for good of their patients, because the difference could be treatment with an ineffective immunotherapy in a patient with a EGFR or ALK mutations, when there's an available, simple, non-toxic oral agent that has a durable clinical benefit and is just one pill a day, perhaps. So I think comprehensive biomarker testing is important for every patient. And as I mentioned, now in every stage of disease too, as well, where not just metastatic patients, but even patients undergoing surgery or chemo and radiation for stages 1, 2, or 3 should definitely have biomarker testing as well. The basic message is to get comprehensive testing on everybody, wait for the testing results before starting therapy, which is possible in almost every situation. And I know it's difficult for newly diagnosed patients to wait for molecular testing results, but if it's explained to them how important it is to pick the right therapy rather than the convenient therapy, I think virtually every patient can wait, and that usually it's a psychological emergency more than a medical emergency to start therapy right away. So wait for the results and act on them appropriately.